Yeah. Okay. Good morning, everybody. I'm going to go ahead and call our meeting to order. First of all, I want to apologize to you for us having this meeting at 8 o'clock. It wasn't my idea. Secondly, I want to apologize to you the fact that we only have an hour in this room. We've had some problems with, there's so much going on right now trying to schedule a room and a time where would have these meetings, and normally we could have a longer time, and I apologize for that. So far, we've had about, I think, 15 or so folks that have signed up, and I would ask that for your help and cooperation. Being brief is a virtue, and we certainly want to hear from everybody who wants to come and share some information with us. And if you have handouts that you want to leave with us, we'll be glad to take those. And if you don't have the opportunity to say everything you want to say today here at this meeting, or if our time catches us and we don't get to everybody, I sincerely apologize, but my door is open over there in 245. If you want to come by and see me, I'll be happy to talk with you. And Tara, you can give her information that you have, and we'll make sure that we get it. So without any further to do, we're going to go ahead and get started as soon as I get my list back so we'll know who to call. And we want to thank our committee members for being over here too. And breakfast will be served later, Carolyn.
Anybody else sign up? Last call? Not really.
You got it? Okay. All right. Here we go. Easter seals. Donna Davidson. And what I'd love to do is ask you to take about no more than about 4 minutes, folks, because we've got a lot of folks that want to be heard. So thank you.
Happy Valentine's Day. Good morning, Chairman Parrish and members of the Appropriations Subcommittee. My name is Donna Davidson. I am the president of Easter Seals North Georgia, and I'm here representing the Easter Seals Coalition and to speak on behalf of the Champions for Children program. First of all, I want to thank the committee for supporting Champions for Children and the fiscal year 2019 amended budget with the addition of $480,000 in tobacco settlement funds. Today, we are respectfully requesting that $513,000 be added to the base funding in fiscal year 2020 budget. It is not in there currently to continually help the 421 children that we are serving who are medically fragile through the Champions for Children program. We have passed out our case statement, which sort of goes through the history of the Champions for Children program. And I'm happy to talk more if you have any questions, but I'm respecting the time limits for today.
Thank you very much. Any questions from the committee while we're here? Thank you. Matt Caseman. Next will be Rusty Paul, if you want to get lined up here on deck.
Thank you, Mr. Chairman and members of the committee, for allowing us to speak with you today about the GNF Peer Assistance Program. I'm Matt Caseman. I'm the CEO of the Georgia Nurses Association and Georgia Nurses Foundation. I have with me Barbara Austin. She is the chair-elect of the Peer Assistance Program, and she also serves as a case manager for the program in a part-time capacity. For over 35 years, our volunteer-based program has dedicated countless hours of community service to a population of Georgia nurses with substance abuse disorders. We have reached our operational capacity threshold and are facing an unmet community need. We are requesting a state budget appropriation that would allow us to fund staff positions to meet this need, and the funding would help us provide our services to more nurses while maintaining the quality assurance and integrity of the program. You should have handouts on your desk and with a breakdown of the funding request. We're happy to entertain any questions.
Good. Thank you, Matt. Any questions for Matt? Thank you. Oh,
Thank you.
well, we have a question. Hold on. Okay. Matt, hit your button there. Was that 20? Okay, go ahead. 20. That's it.
About Thank you, sir. Can you hear me? Thank y'all for being here. Quick question. So currently, y'all are serving, this program in Georgia serving about 180 nurses. I just want to make sure I fully understand the program. And GNA has for many years, I think you said 35 years, this has been all volunteers. And so those 180 nurses have substance abuse issues. And y'all are helping them to get back on their feet, to get clean, and to get back in the workforce.
Correct.
And help me to understand more fully what specific positions you're trying to fill with some state help. Help me understand that a little more
They're
specifically.
case managers.
Yeah,
and-
I'd love to answer that. Hi, I'm Barbara Austin. What we're looking for is funding to help support the role of the case managers in our program. Our program actually has two prongs. One prong is our peer support groups, and the other is the monitoring component. And so we have a part-time position right now that is doing the monitoring for the nurse program, which includes the quality assurance of our drug screening program and monitoring any positive or any issues. We report all the information to the Board of Nursing, and so it's a typical model of case management. And so each case manager FTE is equivalent to about 180 nurses, which is where we are right now. And so we're asking for funding for additional support for those positions.
Thank you.
You're welcome.
Thank you very much.
Thank you.
Rusty Paul and then Nancy Parrish be next.
Mr. Chairman and members of the committee, thank you for the opportunity to make my presentation this morning. I'm Rusty Paul, representing the Home Care Association of America, the Georgia chapter. And I'm here to let you know there's a crisis brewing in Georgia and the rest of the nation on the looming shortage of personal care workers and home health aides to provide care at home to the elderly and disabled. Last year's Work Study Committee shined a light on the seriousness of this problem, and if the state is to continue providing community-based services to people in need and as an alternative to nursing home care, it has to address this and address it now. It has to pay for the cost of care and make it worth the while of the employees to keep doing this work. It's already beginning to be, because they haven't had a rate increase since 2014, being able to pay their employees a competitive wage is becoming a more and more challenging problem for them. In fact, there's already a significant drop in workers entering this field, and many are reaching retirement age who will not be replaced. On top of that, 3 years ago, the industry suffered a terrible blow with the change of federal overtime rules for companions and caregivers. Costs of overtime pay skyrocketed for providers, and they were required to pay for travel time. Last session, you ladies and gentlemen of the legislature passed a bill, which was a good one, to require all providers to conduct costly fingerprint checks for all the employees, but it adds cost to the process and the progress of doing these services. And then coming in January 2020, the feds are requiring all providers to implement electronic visit verification. This requires the use of software and technology that today is not required. While all of these charges are to improve quality, they come with a cost. The federal and state governments have created unfunded mandates on this industry, and providers have borne the cost of these new pay rules, and now they're facing new rules and a very tight labor market. Our request is a rate adjustment which will be used to increase the wages that are paid to our employees. We ask for a 10% increase in the reimbursement rates for personal care services under CCSP and SOURCE waivers. The last increase, as I said, came in 2014 when we received about 5%. That had been the first rate change in more than 10 years, and it was necessary to help providers pay the cost for the added price of adding health insurance under the Affordable Care Act. We believe that a 10% rate increase, which will cost about $11 million in state funds, is necessary, and of course the federal portion of that is 67.3%. We really would request your assistance on this, and thank you for the opportunity for presenting our case.
Thank you. I believe we have a question. Representative Hughley, okay, go ahead.
Thank you, Mr. Chairman. To Mr. Paul, with this 10% rate adjustment, you said it's going to be used to raise the salaries of the workers. Tell me what the average wage is going to go to after if you were successful in getting this 10%?
Fortunately, I got some backup here, so we've got some members of the industry here. I'm going to let Mr. David Lamb answer that question for you.
I'm with CareMaster Medical Services. For our CNAs, that rate averages about $9.70, $10.21 with overtime. And those rates, we're experiencing over 70% turnover. Turnover is up. We have increased wages between 4 and 5%. 2018 was the third year of doing that. So there's been a lot of effort, but there's only so much that we can do. And the high turnover hurts continuity of care for those folks which we care for.
So with the 10%, where are they going? With the 10%, is that they're going to $9.71 an hour with the 10%?
No, that's where we are now.
Or with the 10%, what do you anticipate that the rate?
I would anticipate that we would have wage rates for CareMaster in the $10.50 to $11 range.
Thank you.
Thank you.
Okay, next, Nancy Pierce, and then Brian Ginn, please.
Thank you, Mr. Chairman, for the opportunity to speak this morning. I'm Nancy Paris, the president of the Georgia Center for Oncology Research and Education, and I'm speaking on behalf of the unified request for $887,500 in new money that will be divided among Georgia Corps and my colleagues from regional cancer coalitions. There are 5 that cover a majority of the state. And we have representatives from Rome and Columbus and Macon here with us today. There's an information sheet on this. We have elected to come to you as members of the Georgia Cancer Control Consortium to ask for funding for the final year of the 5-year Georgia Cancer Plan that we've worked on developing. We have impact analysis on the results of our work, and we have measurable goals and a coordinated program that reaches deep into the state. All rural counties are served by members of our coalition, and I just would like to remind you, because I represent an organization that is dedicated to research, how important the sharing of best practices is, the exchange of information among professionals, and also the research that's conducted in our state, whether it's clinical trials, cancer care delivery, or population health. In our regional cancer coalitions, we provide education and screening and navigation, and those are services that Georgia Corps also links to. I know that many of you have experience with family members who have cancer. Hopefully they've been able to receive care in Georgia, because we truly have exceptional care, and this was not true 15 years ago when we developed this plan for a statewide cancer care delivery system. Georgia will receives an average of about $167 million a year in tobacco settlement funds. Georgia Corps just released a report on this. If you don't recall seeing it, we'll provide it to you. It shows how the funding has been spent in each category so that you can make wise and informed decisions about how to invest. So in addition to the $887,500 that we're requesting for these programs, we're also asking you to consider a new $1 million in funding so that we can implement 2 models that will expand our effectiveness and our reach statewide. These are scientifically proven. One is an ECHO model that will allow academic centers and community providers to learn best practices and disseminate those into the state. And the other is a roundtable model that's been perfected in part by the American Cancer Society and will enable us to screen for cancers, particularly lung and colorectal, diagnose those earlier when treatment is more effective, which of course is a goal that we all share. I thought I'd close by telling you a story because you always ask, Mr. Chairman, you know, how does this influence or impact people in the state? And my colleagues from the regional coalitions have them as well. But about 11 months ago, we received a call from a woman in her early 60s who had just been diagnosed with bladder cancer. Her family was encouraging her to go for the best care, Memorial Sloan Kettering in New York. She did go there. She received a workup. She called us back and said, look, I've got this plan. I just wanted to ask, could you take a look at this? What do we have in Georgia for bladder cancer? Her life expectancy was 4 to 5 months. 11 months later, she's here, and she received care at Winship. The treatment that's offered here was exactly parallel to the treatment plan at Memorial Sloan Kettering. And 15 years ago, we were scared that patients were going to Birmingham instead of staying in Atlanta. Our care and support and networks have completely transformed. And bladder cancer, in case you're not entirely familiar, not only is there a high mortality rate, but there's surgery, radiation, chemo, immunotherapy, all those things we have. Why should a person have to leave Georgia when their family's here, their work is here, their home's here? And we indeed have the best, including over 600 clinical trials. So we urge your careful consideration of this. Each of you have received us very warmly, provided guidance and support, and I can't tell you how much. Truly, we appreciate that. I'll be glad to answer any questions, Mr. Chairman.
Thank you. We have a quick question from Representative Gardner.
Much. Thank you, Ms. Paris, for all you're doing for our state, particularly in bringing these groups together so that they don't come individually asking for money, and I hope they're all happy. You mentioned...
They're nodding.
Are they nodding?
Oh, yes. Yes,
no,
ma'am.
I think it's helpful for us. I appreciate your leadership on doing that. You mentioned that this is the final year of a 5-year plan funding.
Yes, ma'am.
I thought that was encouraging, meaning, oh, maybe that would be all we need to come up with for a while.
We're developing a new 5-year plan.
I bet you are.
Based on emerging evidence about treatment options and evidence-based practices, and that's under the Georgia Department of Public Health, which is where our funding is contracted.
Okay. Thank you very much for what you do.
Anything else, Mr. Chairman?
Yeah, thank you very much, Nancy. We
You're most
appreciate that. And she mentioned something, and I'll just say this to you too. I know that there were several groups that are like-minded trying to work on the same project, and it really helps us if these groups get together and sort of come and speak to us with one voice, so we don't have to try to put on our referee shirt and figure out what we need to be doing. So thank you for getting your group together and sort of speaking with a united voice on that. Thank you very much.
I believe we learned that from the two of you, and we thank you for that, for being honest enough to tell us the truth about how to do a better job.
Makes our job easier.
Good.
Too. Thank you.
Thank you, sir.
Brian Ginn, and then we'll have LC Blasingame.
Thank you, Mr. Chairman and members of the committee. I am Brian Ginn. I'm privileged to serve as the Chief Campus Officer of the Philadelphia College of Osteopathic Medicine, an institution that was founded over 120 years ago, that in 2005 established a campus in Suwanee, Georgia, in Gwinnett County. 13 years later, Mr. Chairman, we have expanded from 80 osteopathic medical students on our campus to over 1,100 students in the academic programs to include osteopathic medicine, pharmacy, physician assistant studies, physical therapy, biomedical sciences, master's degree program. In that short time, we've graduated over 1,000 osteopathic physicians that are impacting positively on the Georgia workforce. The GME funds that you have provided to multiple health systems across the state of Georgia has helped create osteopathic residencies over the last several years, and we appreciate your support for graduate medical education. And to answer a question from yesterday's hearing, Mr. Chairman, the merger of the AOA and ACGME accreditation will create one pathway, if you will, for medical students in the future to find residencies that don't have to compete with osteopathic residencies or allopathic residencies. One pathway we think will be extremely beneficial to our graduates in staying in Georgia. Mr. Chairman, we thank this committee for its confidence and its support in providing capitation funding for our medical students, and in addition to providing $200,000 in startup funds for our new campus, PCOM South Georgia, down in Moultrie, a project that we're very excited about. We'll use those funds for educational simulation equipment and pipeline programs, working with high schools and colleges in the region to make those students in that area know that they've got opportunities and pathways toward medical education and health science education. I invite you to take a look at pcom.edu to look at the evolution of a $28 million facility that's coming up out of the ground in Moultrie, a facility that's being funded by PCOM with significant community support from the region of South Georgia. Recognizing the language that this committee and the conferees placed in the budget last year, we look forward to working with this committee and others in the General Assembly to look for partnership opportunities in the days to come, as the state has shown a propensity to support private medical education for the benefit of the workforce in Georgia. And just as an anecdotal note, Mr. Chairman, I did want to highlight to you one of our graduates, a graduate who came to Georgia from another state, but who chose to stay here when she, after having breast cancer while a student in medical school, chose to accept a surgical oncology rotation residency here in Georgia over in Augusta at the Augusta University Health System. Dr. Alicia Vineyard was recently featured on Augusta University's health system as a doctor of compassion. And so we want to simply leave you, Mr. Chairman, with the idea that we are graduating in Georgia osteopathic physicians who are here and who are coming to Georgia and are staying. So, Mr. Chairman, we thank you for the opportunity. We look forward to visiting with members of the committee to talk with you about a 5-year plan going forward for the days to come for our efforts in South Georgia.
Good. Now, we have a question. Representative Taylor.
Thank you, Mr. Chairman. As much as it is a question, it is to thank you for bringing this opportunity to residents and young people in South Georgia. Do you know when your first students are going to be up and running down in Moultrie?
Madam Chairman, we do. We certainly do. We have, as our project is coming up out of the ground, the accreditation body is there this week, in fact, in Moultrie, putting the final touches on our approval to go forward. We are confident that all will be well and that we will be matriculating our first class of osteopathic students, 55 students, beginning in August of 2019. So we invite you at this point to come to a ribbon cutting for our new facility in August of this year. Very excited about the opportunities ahead. And excited about the opportunities to expand other academic programs in the region as well once this takes root.
Thank you, and congratulations on those great efforts. Thank you.
Thank you.
Okay, Brian, thank you.
Thank you, Mr. Chairman.
Elise Blassingame and then Russell Carlson be next.
Good morning, Mr. Chairman, members of the committee. Thanks for hearing from us today. Healthy Mothers, Healthy Babies Coalition of Georgia respectfully is requesting appropriations to establish 6 rural mother-baby satellites in each perinatal region of the state. We spent the better part of 2018 reviewing the data pertaining to maternal and infant health outcomes. We looked at infant mortality, low birth weight, prematurity, and inadequate access and utilization of prenatal care. And we looked only at the rural counties that were underserved. We also looked at only counties that did not have any prenatal care services, had a labor and delivery closure, or never had a labor and delivery unit at all. Also does not have a crisis pregnancy center or resource center, and would not be a duplication of any services either by a state agency like DPH or any private entity. So in these counties, these 6 counties, one for each perinatal region, there is no prenatal education. There's no prenatal services of any kind provided at this time. The counties that we found that had the poorest outcomes, and that means that the outcomes were not only worse than the national average, but also worse than the state average in these categories, were Wilcox, Rabun, Jenkins, Appling, Meriwether, and Randolph. So that's representative of one for each of the regions across the state. In front of you, you have a profile of each of those counties so you can see what those outcomes look like. And our request is to establish these mother-baby satellites that have 3 pillars of work. The first is evidence-based prenatal education. That is Georgia-specific. It's a tested model we've used in other parts of the state. Access to existing resources and programs that improve maternal and infant health outcomes. So again, not duplication of services, but amplifying what our state agencies and private partners are trying to do in the region. And then capacity building and workforce development. So training perinatal professionals such as community health workers, doulas, educated and certified childbirth educators, which we have a severe lacking of across the state of Georgia, to make sure that the local workforce is capacitated to make sure that our outcomes are sustainable in the long run. So we appreciate your consideration. And Mr. Chairman, I'm happy to take any questions.
Thank you. Don't have any questions. Thank you.
Thank you very much.
Okay, next we're going to hear from Russell Carlson, and then Sally Buchanan will be next. And let me remind you, when you come to the podium, if you would, please give us your name and the organization that you represent, just so everybody will be familiar with that. Thank you.
Thank you, Mr. Chairman, members of the committee. My name is Russell Carlson. I represent the Georgia Healthcare Association, which is comprised of Georgia's skilled nursing centers. And I'm here today with a pretty sincere yet simple theme that to ask this committee and the body as a whole to continue helping us get better. Georgia is actually, Atlanta, Forbes magazine just within the past year wrote an article that described Atlanta as the fastest aging city in the country. In addition to that, U.S. Census projections show that Georgia's over age 85 population will grow 83% by 2030, the highest growth rate in the Southeast. We outpace Florida even in that metric. And with the 75 and older population by 2030, we're second only to Florida in those projections. So we know that the aging population will find its way to Georgia, and so our request of the committee and the assembly is to help us prepare for that, namely in staffing. To my friend Mr. Paul, and I know Mr. Neff will be speaking, Ms. Helms with Leading Age will be speaking. They're going to say a lot of themes that are true, and that thanks to your policies, Georgia has found ways to allow people to age longer in the community, whether it be in their home or community-based settings. And we support that. Our theme is the right person, the right place, the right time. But the result of that is that when many individuals do find their way to a skilled nursing facility, they're sicker. The acuity is higher than it was years ago. So we are trying to seek and retain more qualified staff, and I always want to know that before we stand before an appropriations committee asking for more funding in this endeavor, we do our legwork year-round. We're constantly sitting down with deans of nursing, with the technical colleges, with career academies, about how to recruit younger people into long-term care and how to keep them there. And your support in the appropriations process these past couple years has gone large part to staffing to help us with these individuals in our facilities. Georgia's skilled nursing centers serve over 33,000 individuals, of which greater than 73% are enrolled in Medicaid. In rural areas, that number is closer to 79% Medicaid. And so we consider very much ourselves partners of the state in caring for these individuals. And I know we're short on time, so I will yield the rest of my time for any questions, but we are asking your help in coming off our moving towards a more current funding mechanism that would allow us to capture our current costs and keep these good people in our facilities.
Thank you, Russell. Representative Petrie has a question.
Yeah. Thank you, Russell, and I appreciate your help in my study committee on workforce around this same issue. Everyone in the industry is struggling with it. The degree to which we passed Senate Bill 406 last year, the fingerprinting bill, tell me about the impact of that bill. We know that it was the right thing to do. I strongly supported that bill, but it is an economic hit, I guess, to all providers. Help me understand the degree to which that is impacting the skilled nursing facilities.
Yes, sir. I have that number here. You're right, Mr. Petrie, in that it is a worthwhile endeavor, and we are a part of any public safety conversation that goes on in the Capitol that involves our most vulnerable population. It will go into effect this year for incoming as we make new hires and then go into effect January 1st for existing employees, which will capture everyone. We have estimated our centers after intensive surveys and analysis have put the cost of the enhanced background checks at $660,000 in state funds. That would equate to $2 million for the entire system to be fully integrated and operational.
Thank you.
Yes, sir.
Thank you, Russ. Let's see, Sally Buchanan, and then Micah Whitfield next.
Good morning, Mr. Chairman and committee members. I'm Sally Buchanan, and I'm the CEO and the founder of Creative Community Services, and I'm also the chapter chair for the National Association of Family Focused Treatment Association. Our agency is a foster care agency that serves children and youth that have been severely abused and neglected. And we were the first therapeutic foster care agency in 1988 when Georgia had and started therapeutic foster care. I am here to ask your help on two Medicaid issues that actually affect the youth that we serve in our agency and also in other agencies very severely. They are in need of meeting, and they're also needed, these issues need to be met through Medicaid in order to meet the requirements that are coming down from the federal government on the National Family First Services Act. Over 10 years ago, Georgia unbundled the Medicaid services that affect foster care services, which at that time that eliminated the therapeutic foster care. And youth were to be served in foster care agencies and then receive any treatment or therapeutic services only from a 50-minute therapy session or also medical review by a psychiatrist. So we did completely away with a therapeutic environment in a therapeutic setting. These youths have a history of severe abuse and neglect, and they're in and out of psychiatric residential treatment facilities. They've had as many as 30 different placements within their life. In order to be placed back in the community, they need a therapeutic foster care setting, and this is also a preferred placement for youth that have that are needing out-of-home placement in the Family First Service Act that is coming down. TFC provides a foster home that has foster parents and agency staff that are trained by a evidence-based model of therapeutic foster care, and they also are supported, the child and the family, 24/7. In order to provide this, we are asking for Medicaid dollars to be rebundled in order to provide therapeutic foster care, because these youth need to be provided care in a therapeutic setting. Without a therapeutic setting, these youth are going to remain in our in our psychiatric residential treatment facilities and in and out of the whole system itself. The other thing that we are asking is, the second issue that we're asking help with, is that these youth at age 21 are no longer able to remain in foster care, and everyone knows they age out at 21. Many cannot live independently, and that's due to their functioning and their cognitive ability, and a lot of this is caused by the trauma that they have had through all of their years. They don't qualify for the Medicaid waiver that is set up as the NOW and COMP waivers under the for developmental disabilities, because these children do not fall in that category. They don't have below a 70 IQ. The youth that I'm talking about have an IQ of about 70 to 85. So if you have an IQ of 71, you're not qualified for a developmental disability Medicaid waiver. So there are no programs in Georgia that provide housing and supervision for these young people. They have no safety net at the age of 21. And because of this, they become homeless, they become sexually exploited, and they become part of our prison system. The statistics on youth that age out of foster care at 21 is that 1/4 of these youth that I'm talking about have mental health issues, 50% are homeless within 6 months, 49% are prostituted and raped, and 1/5 are jobless. In fact, there is 19% of the unemployment rate can be linked to former foster youth. I am only one agency that serves some of these children, and we have other agencies that do that. One of the individuals that I serve in particular will turn 21 and age out of the foster care system in March. And she has been in and out of psychiatric residential treatment facilities between the age of 8 and 18 due to severe physical and sexual abuse. That young woman with us, who's living with us right now, she has made great strides because she gets a therapeutic foster home. She also gets that oversight. She gets job coaching, life skills training, the things that these youth need once they turn 21. They can't just go right out into the community. So what we are asking is if you could provide us with a Medicaid waiver, an estate plan amendment, or a pilot that would meet the needs of the youth that I'm talking about. I want to thank you for your time in considering this and listening to me, and I will be providing other types of statistics in writing this afternoon.
Okay, Representative Petrie has a question.
Yes,
for
thank you, ma'am, for being here. I'm thoroughly depressed now.
I'm sorry. First thing in the morning, right?
Yes, listen, a couple of things I want to help. I want to understand because I'm very interested in what you're saying. First of all, did you just say that 19% of our unemployment could be attributed is due to former foster youth?
That's correct.
That's
Youth
a pretty
that were in-
powerful statement.
It's a very
You're
powerful.
pretty confident of that fact.
Yes, I do, and I have all the
Okay.
statistics that I will be sending y'all and the resources.
That's interesting. Okay, obviously, so you mentioned these are not comp, they're not now waiver because they're not developmentally disabled. These are children who don't have developmental issues.
That's correct.
They simply have been abused, mistreated, exploited, whatever the case may be, as children, right?
Correct.
And so you mentioned that you gave a range of their IQs that suggests that they are still low IQ.
They are.
I'm having a hard time understanding that.
Okay.
I mean, a child that can be exploited or abused, their IQ has nothing to do with that. They're born with an IQ. They're not developmentally disabled. So I don't understand. So they're obviously now aging out. They're 21 years old. Mm-hmm. The safety net that is there is that which is available to everyone who has these children have mental health issues.
Correct.
These are behavioral health issues, mental health issues.
Correct.
They're not developmental.
They also
So we have a system that serves those with mental health in this state. So I'm trying to understand why they can't be served. And I was particularly interested in you suggested they were low IQ because your IQ really, there should not be a direct correlation between IQ and abuse, should there?
Well, what happens is because of their abuse and maybe they were slowed down in, there's a lot of brain research about that, which I won't go into, but we can give you that information. But what happens is these youth they're cognitively do not operate and cannot make good decisions.
Okay.
They fall in that 70 to 85 IQ is usually about what that is. They don't make good decisions. On a good day, they may have a test and they'll be at 69. But Tony, for example, is one of the individuals I'm talking about. She's going to be 21. She is a 73 IQ. She does not make good decisions. And what we have actually we've worked with Viewpoint Mental Health to try to find out if there's something that we can serve Tony with in a day program and also in a residential program. There is not anything. And I'm talking about, like a group home or a small.
And in the interest of the committee having time to hear from everybody, I'd love to learn more later.
Okay.
But I was trying to, obviously, I would expect children like that have been abused to have poor judgment. I was trying to understand the parallel with IQ. But one last thing I'm going to ask you very quickly. We have raised foster rates over the last few years here, made an initiative to do that in this legislature. Has that impacted your programs as well?
Yeah, we're a part of that system. However, it's
right.
been such a small rate increase that it has not, because we have to provide 24/7 supervision. The foster homes are specially trained. They receive daily oversight. They are seen on a weekly basis. We provide the behavior intervention programs. We provide a whole lot of things that it takes to serve a child with those needs.
Thank you, ma'am.
Thank you.
Okay.
Thank you very much. Let me just remind the presenters and the committee that we've got a lot of people who signed up, and let's try to be fair to everybody. And some of these, we need to hear a lot more than we're hearing today, but some of this may be better offline. So let's just try to move along as rapidly as we can, but giving everybody an opportunity to be heard. Micah Whitfield, and then Michael Brooks.
Good morning, Mr. Chairman and esteemed members of the committee. My name is Micah Whitfield, and I'm here representing Postpartum Support International, where I serve on the board of directors. We appreciate you taking the time to hear us today. As you may be aware, the Department of Public Health last year applied for a grant from HRSA to support maternal mental health in Georgia. That grant unfortunately did not get funded, but DPH was ready to implement, and they had wide support from a broad coalition of partners. As such, we're here today to request that the funds necessary be appropriated to implement that program. In front of each of you is an overview of the proposal as put together by DPH. In addition, you also have letters of support from a number of coalition partners that are in support of that program, and many of our stakeholders that would like to see this initiative move for our moms in Georgia. So for the sake of time, I'm going to ask Calvin Mackey from Emory Government Relations to share additional statements on their support and implementation of this program.
Thank you.
Thank you. Good morning, Mr. Chairman and members of the committee. I'm Calvin Mackey, and I represent Emory University. Thank you so much for your consideration of this proposal, and I also want to thank our coalition partners, Healthy Mothers, Healthy Babies, and others for their support on this. I'll be very brief, as you do have more information in your packets. But essentially, the funding would allow us to establish a telepsychiatry line, and that would be available for providers across the state to receive guidance on treatment and referral on perinatal psychiatric cases. Part of the funding would also allow us to support obstetricians, midwives, and primary care physicians on these perinatal psychiatric illnesses, which of course are very complex, and we would do this by providing real-time consultations. Essentially, the goal is to be able to treat these patients close to home, and I'm very excited that the proposal would leverage the county public health departments and using a lot of the resources that are already in place to try to expand this care. I'm happy to answer any questions, and again, you have more information in your packets.
Thank you. Any questions? Thank you very much. Dr. Michael Brooks, and then Emily Jones.
Good morning, Mr. Chairman and members of the committee. I'm Dr. Michael Brooks. I'm the president and CEO of the Family Health Centers of Georgia, and I'm here representing the Georgia Primary Care Association. The association represents 34 individual organizations around the state that has 100 that are located in 125 counties with 225 standalone sites. We provide primary care, basically adult medicine, pediatrics, OBGYN, and dentistry. We also provide vision and behavioral health, and to individuals regardless of their ability to pay. Our main mission is to improve outcomes in individuals who present to us for care. In addition to the 225 sites, we also have sites located in school-based health centers. They're designed to increase outcomes and academic achievements in students in school who otherwise wouldn't have access to primary care services. We also have mobile units that go out in areas that are not served, that provide primary care, dental, sometimes vision, and behavioral health. We are asking the committee and thanking them for their continued support and expansion dollars that have helped us expand into underserved counties, and we want to continue that effort. We also want to look at ways to market access to our services because they're needed. We see about 225,000 Medicaid patients, and we see about 200,000 people who are uninsured every year around Georgia. And the ability to know about how can they access primary health care is essential to improving outcomes in our state. Our other initiative is to improve access to integrated behavioral health. As we know, listen to other people talk around behavioral health is a major issue in this state. And as an organization, about 30% of our patients are dually diagnosed with behavioral health issues and primary care chronic disease. So we want to thank you for your continued support, and we want to ask you to continue to help us in our expansion efforts. I'd be happy to entertain any questions if you have any.
Okay. Thank you, Dr. Brooks. Any questions for Dr. Brooks? Thank you, sir.
Thank you.
Okay. Emily Jones, and then Daniel Thompson.
Good
Good morning. Thank you, Mr. Chairman and members of the committee. My name is Emily Jones. I'm with the March of Dimes. Today I'm here to talk to you about 3 budget priorities that affect the health of mothers and infants in our state. The first is expanding the state's newborn screening panel by adding 4 new treatable conditions to the state's panel. Newborn screening is a vital public health program that affects the outcomes for hundreds of babies born each year. Georgia currently screens for 31 of the 35 nationally recommended conditions, and in 2018, the commissioner recommended the addition of 4 others: Pompe disease, MPS 1, XALD, and SMA. These conditions can be treated early, but early intervention is key to the success of the treatment and the reduction of morbidity and mortality. The March of Dimes supports a $2.3 million appropriation that would allow the state to add these additional 4 conditions. The second 2 budget items relate to the crisis of maternal mortality in our state. As many of you know, Georgia consistently ranks lowest for maternal mortality in the nation. This year, we are actively advocating for 2 distinct budget items that would address this issue. The first is building on the work of the Georgia Maternal Mortality Review Committee and the Department of Public Health, seeking an appropriation for $200,000. This would fund 2 additional nurse abstractors for the review committee to speed up the data analysis and produce reports at a faster rate. The second is a $500,000 appropriation for Morehouse School of Medicine to establish a center of excellence for maternal mortality research. This appropriation would allow Morehouse to do research and to examine the causes and potential prevention methods for reducing the rates of maternal mortality in the future. The March of Dimes supports both these appropriations to address this crisis from multiple angles and build upon the important work our state has done to save women in the past few years. Thank you for your time, and I'm happy to answer any questions.
Thank you. Any questions? Thank you very much. Daniel Thompson and Teresa Hurd next.
Good morning, Mr. Chairman, members of the committee. My name is Daniel Thompson, and I represent the Georgia OBGYN Society. We are the statewide professional association for OBGYNs in Georgia with over 1,000 members. I come before you today to request 3 critically needed items in the FY 2020 state budget. The first item, as Emily Jones mentioned, is $200,000 in the Department of Public Health budget for 2 new nurse abstractors. Currently, the Maternal Mortality Review Committee has 1 full-time nurse abstractor to review all the maternal death cases and present those before the Maternal Mortality Review Committee. These 2 new nurse abstractors would be very beneficial to reviewing maternal death cases in Georgia. The second item is would fall in the Georgia Board of Physician Workforce budget, and it's a request for $865,000 to fund all existing OBGYN residency slots in the state of Georgia, much in the same way that family physicians and pediatricians are currently treated. The General Assembly has done this the past couple years, and last year the General Assembly appropriated $306,600 for OBGYN slots in Georgia, and we're very appreciative of that. The final request, as Perinatal Support International mentioned and Emory University, is in support of the perinatal telepsychiatry program. This would bring much needed access and services to mental health services for women who are struggling with postpartum depression, which, if left untreated, it can be severe and often lead to maternal death. So thank you very much for your consideration. I'm happy to answer any questions.
Thank you, Daniel. Any questions? Thank you. Teresa Hurd, and next after that, Misty Carey, I believe it is. I'm having a little trouble with that.
Hello, good morning. My name is Teresa Hurd, and I'm representing Easter Seals Georgia Coalition and the Champions for Children's program, which is a statewide program, and the 421 parents in the program. I am also a parent of a son with autism. I want to thank you for all of your support for Easter Seals and the Champions for Children's program, and I will hope that you will continue to support this program in the FY 2020 budget. As a parent, these services are vital for Georgia families who have children with disabilities. We also have another family member here who's actually in the program who actually has a short story to tell you about how the program has impacted him.
Good morning, Chairman and the other honorable members of the committee. My name is Niranjan Krishnamurthy, and my children receive services through the Champions of Children. My daughter, 2 years old now, was diagnosed with spinal muscular atrophy when she was 6 months old. before that, I actually saw Ms. Emily Jones talk about adding SMA to the newborn scheme. I personally support that. My daughter receives services that includes medical supplies, equipment, services, therapies, dental, optical, recreational, and therapeutic services through a lot of programs. But I sincerely hope Champions of Children is doing a very good job by helping all our families who are being diagnosed with SMA. SMA is the genetic disorder that's the #1 cause of infant death, which because of SMA, all the children are deprived of the muscular strength, which doesn't allow them to sit, crawl, walk, breathe, swallow. My daughter is fed through G-tube, which she doesn't take anything by mouth. She doesn't crawl or cannot sit by herself. Champions of Children is helping me a lot of these therapeutic services that I avail, and I do see a lot of doctors, and I do go to a lot of the therapies which Champions of Children is helping me with. Without this funding, it will be really tough for me to give the quality of life to my children. I sincerely hope that you would continue this program in the upcoming years also. Thank you so much.
Thank you, and we thank you for making the effort to be here today also. Thank you. Let's see, Misty Carey and then Stephen Neff.
Okay. Good morning, Mr. Chairman and ladies and gentlemen of the committee. Thank you for having me today. My name is Christy Carey. I have been an RN for the past 21 years, and I am the Area Vice President of Operations for the largest provider of pediatric home care in the U.S. and within the state of Georgia. We provide, or we offer services to children in every county in Georgia through the GAP Medicaid waiver program, or the state plan. And that program covers kiddos from birth to 21. The patients that we serve are dependent on feeding tube, trachs, ventilators, and require nursing care at home. The best way to explain it to people that are unaware of these children in our community are my company basically goes in and sets up a mini ICU in someone's house. So if you went into one of my patients' homes, you would walk into the bedroom, you would see a hospital bed, probably a ventilator, suction, oxygen, basically, and lots of medical supplies. So when you go in, it's going to look like the same type setting as if you walked into Children's Healthcare in one of their ICU units. The nurses that care for these children work shifts, so they're there for 8, 10, 12 hours at a time. We are very grateful for the rate increase that we did receive last session, and we are wanting to ask for additional funding. We are continuing to work hard to fill all of the hours that the doctors have ordered. There is a nursing shortage in Georgia, but specifically in home care. We really struggle, but there are lots of challenges with being a home care nurse. I don't have time to go into all of those today, but I can go into that at a different time. Georgia rural areas are hit most significantly, and the big reason for that is that the nurses in those communities do not have a skill level to take care of the children in the communities. So if one of those children have an exacerbation of symptoms or an emergency event, they'll go to their local hospital, but they'll be flown to one of the children's hospitals. So it's up to companies like mine to provide extensive education to nurses to allow them to develop the skill levels to take care of these patients at home. I represent the home pediatric nursing community and ask for you to consider increasing our reimbursement rates for the GAP program. And our intention with that additional money is to continue to increase nursing rates, to build a more robust benefits package for the nurses to attract them, and to continue expanding our nurse education program.
Thank you.
All right.
Do we have any questions? Thank you very much.
Thank you.
Stephen Neff, and then next, Jenny Helms.
Morning, Mr. Chairman, members of the committee, Steve Neff.
Melissa Allman with Beata, and in the essence of time, Beata is also a member of the GAP program. We wanted to support the previous speaker on theirs. I do want to mention that we do thank you very much for the work that you did last year. We received rate increases last year, Mr. Chairman, of $2.50 for the LPN and for the RN, which we're very thankful for. Our original ask was $5, and we're thankful that you all filled half of it. We've had a chance to speak with many of you about trying to continue that this year from to the $5, so an extra $2.50 to $3. The total comes to about $1.1 million state dollars, and I'll make sure that I get that information and hand out to Tara. I do want to mention as well that I wanted to follow up on Russell Carlson's comments. Staffing is our biggest issue. It's our biggest issue in home care. It's the biggest issue in pediatric home care. The training, as Ms. Carey mentioned, it's a real strain on us. Just finding qualified people to work for us is a real challenge. We thank Mr. Petrie for his workforce study committee, and we look forward to working with all of you again to try to address some of the staffing issues that we're all dealing with. But most importantly, Mr. Chairman, we have to pay them adequately to try to entice them to come to work with us, and that's the important part that we're trying to address today. Thank you.
Good. Thank you. Okay. Jenny Helms and then Michael Cortez.
Mr. Chairman and members of the committee, I thank you for the opportunity to be here today. I'm Jenny Helms, president of Leading Age Georgia. We're an association that is membership-based, and we serve the not-for-profits and other mission-based organizations that serve older adults through the continuum of care. Last year, you all were kind enough to give an increase to adult day providers, which allows people to stay in the community as long as they can have adult day services, and we're greatly appreciative of that. One of the trends that we're seeing is that people want to stay in the community as long as they can, and the adult day fortifies them, so we're very grateful. And then those who can stay in the community with in-home care, they choose in-home care. When their health becomes so frail that the family can't take care of them, even with in-home care, they're commonly choosing assisted living care. And so the people we see in assisted living now are frail, they have the money to pay for it, and we're happy for them to stay there as long as the care can provide it. But what we're seeing is, though, that the trend is that dollars that used to go into nursing homes for private pay and would fortify that Medicaid rate is not really there anymore. And so what we're seeing is that nursing homes are really getting the frailest people, those who can't stay in assisted living anymore, or those who can't afford assisted living care. And so what we're seeing is that's very expensive to care for these folks, and the Medicaid rate isn't really quite keeping up with what it costs to care. Now, some of our not-for-profit members really want to focus on caring for the person with dementia. And one of our homes recently told me, the CEO over 3 of our not-for-profit homes, told me that he loses $9 a day on caring for people with dementia. And what our not-for-profits do is they raise money to fortify these costs, but they find it a struggle. And the trends nationwide are that they're seeing the same pattern. And in New York last year, 50 not-for-profit homes sold because the Medicaid rate did not substantiate nearly the cost of providing the care. 50 homes. So when those homes were sold, the only way that the new buyer could make it work would be to go in and reduce staffing and other costs that help with the quality of care. So what we're seeing here is the need to really take a look at fortifying the Medicaid rate in Georgia. Now, the rehab rate through Medicare pays a lot higher. So if a person breaks a hip or has a stroke and they need rehab, these nursing homes can get a much higher rate for the rehab rate. And so in order to stay in business, many of them are seeking that market. And that means that people who need Medicaid might struggle to find a bed. And so we really need to focus on fortifying that rate so that the people who need the care can get it. And so for that reason, we strongly support the request of the Georgia Healthcare Association, and we think that we also need to really take a look at increasing the add-on for cognition. So right now, I worked for the Alzheimer's Association 21 years, and we worked with the legislature to get an add-on for dementia care. And so they screen the residents, and if they meet certain scores, they can get an add-on. And that add-on can be as high as 4.5% if there's a large number of people with the really low scores. But the truth is that without losing the $9 a day, we really need to look at fortifying that rate because it takes so much more staff to care for people with dementia. If you have any of the behavioral expressions which are part of it, it takes 3 to 4 times as much staff time to provide dressing, bathing, grooming, toileting, medications pass. And so, you know, it makes sense that we have to fortify that if we're really going to get our nursing homes to care for these folks with dementia. So I'm asking you to support the request of the Georgia Healthcare Association and to work with us on increasing that add-on for persons with cognition. We want to make sure that that person with dementia can find a bed when they need it, and we want to make sure our nursing homes can stay in business. Thank you.
Thank you. No questions. Thank you very much. Michael Cortez.
Good morning, Mr. Chairman and members of the committee. My name is Michael Cortez, and I represent the American Heart Association here in Georgia. And we'd like to wish you all a happy Valentine's Day. What a fitting day to be sitting up here before you talking about cardiovascular care. So, you know, I'll be brief since we are running a bit late here. Despite the gains that we've seen made as a result of the Coverdell-Murphy Act here in Georgia, stroke still remains the 4th leading cause of death in our state, and we rank 10th in the country for stroke mortality. And in many parts of our state, we see 40% higher mortality rates than the rest of the country. So what I'm here to talk to you about today is expanding the Stroke Center program as prescribed under Coverdell-Murphy through a grant program that was created in the bill. And it would allow for the department to award grants to hospitals that would like to become designated stroke centers, but currently don't have the resources. And like I said, while we've seen great strides made under that law, there is a poor distribution of the current centers across the state. And you'll see in the packets that are provided to you, there's a map that shows that the majority of them are concentrated in the metro Atlanta area. And so we'd like to go ahead and see some of these hospitals that have the need for those patients to get increased outcomes to have the resources to go ahead and do that, to do that. And you'll go ahead and see the first 2 hospitals on that list account for about 25% of the stroke patients seen in Georgia. And so the data shows that when these hospitals are designated and accredited, they have increased outcomes up to the tune of 25%. So, you know, that'll be it. I won't take up any more of your time. I'll be free to answer any questions you might have and meet with any of you in person. But we think this is a very important ask, and, you know, we hope you go ahead and consider it.
Representative Gardner has a question.
Quick question. How many of these people would be Medicaid eligible if Georgia were to expand in some way through a waiver or through a real Medicaid expansion?
And I don't have that answer for you right now, but I can go ahead and get it for you.
Would you guess it would be a high number?
I would guess it'd be considerable. I'm not sure. I can't speak to it specifically.
Thank you.
Okay. Any other questions? Thank you very much.
Thank you.
I'm not looking for speakers. That's the last one I have on my list, and I just want to make sure if there was anyone here that wanted to be heard that you had an opportunity to speak. Well, thank you. Thank you all for coming this morning. Thank the members of the committee. I apologize that we had to have this meeting in such a rush, but I encourage you to contact the members of the committee and certainly come by our office if you'd like. Make sure we've got whatever information you want us to have. We'll be glad to take that into consideration as we look on this. And thank you all so much for being here this morning.